Hi, I'm Dr. Maeve Smith. I'm an assistant professor in the Division of Pulmonary Medicine in the University of Alberta, and I'm one of the co-directors of the post-COVID clinic.
Hi, I'm Dr. Grace Lamb, and I'm an assistant professor at the University of Alberta Hospital. I am a co-director of the post-COVID clinic. Our clinic has started in June of 2020 with the support of AHS and the K. Edmonton Clinic and the University of Alberta Hospital.
We anticipated that there was likely going to be a need for such a clinic for people recovering from acute COVID-19 infection but still experiencing severe complications or symptoms. Since that time, we have had approximately 720 referrals to our clinic. The way the clinic runs practically is patients are referred, and as they are booked into our clinic, they are also asked to attend for investigations, so lab work, a chest x-ray, lung function testing and the walk test.
We also send these patients questionnaires before the clinic so that even before we see the patients, we get a sense of how their symptoms are impacting their life, their mental health and their functioning. Then we see the patients and we do our comprehensive assessment with them, making sure that there aren't other alternative diagnoses that could be explaining for their symptoms. And then we provide advice and some management strategies based on guidelines that are out in the literature, as well as resources that's been provided through AHS to our patients. Some of these resources include things like recovery guide that can be found on the AHS post-recovery from COVID-19 website. Other resources including the rehab advice line, and this advice line is staffed by physiotherapists, occupational therapists, so a lot of allied health support is available this way.
We have support from dietitians, social work and physical therapists that we can refer patients to directly. We can also refer on to the other medical specialists, as I've mentioned. And importantly, we can also refer patients on to our rehabilitation medicine colleagues as well for ongoing support and help with their management and their recovery.
With regards to the prognosis of long COVID, this is an unclear picture at the moment. What the literature shows and what we have experienced is that overall, patients do improve with time. We're talking about a really long time frame, over months. And there's some reports that have emerged from different parts of the world that seem to suggest that even after a year post-infection, some patients are still experiencing some degree of long COVID symptoms. So I think the message here is that this is a long condition and it's a long journey. Patients should know that they are not alone, that what they're experiencing is something that is true and others in their position are experiencing the same thing, but it is a long journey and it truly is a long haul for some individuals.
I think the really important things to know about long COVID are this condition is very real, it's very debilitating, it is preventing return to work, return to usual daily activities, and it can affect anyone. It happens irrespective of being hospitalised with the acute infection or not.
For the rest of us, we should focus on prevention, doing everything we can to mask up in any public spaces, socially distancing, getting fully vaccinated, and following public health guidelines as they evolve with the evolving nature of the pandemic.
I just want to say thank you very much for watching this video, and just to really urge you that if you do feel that you are still suffering from symptoms related to acute COVID-19 infection, to please reach out to your family doctor for further assessment and review, and know that there are resources there to help you, that this condition is real, and that there are clinics available here in Alberta to help with your recovery.